First off, I'd like to thank all of you for taking time out of your busy schedules to join us today. We'd like to welcome you all to another educational webinar here at Well Traveled Wealth. Today, we're lucky to have Fanny Pacheco here with us to discuss the basics of Medicare. Fanny is a partner at PBI Insurance, which primarily focuses on Medicare senior products and how they can best work for Medicare eligible beneficiaries. Fanny brings 15 years of healthcare management experience to the team. She is PBI Insurance's primary Medicare expert, where she uses her unique provider perspective background to provide Medicare eligible members unsurpassed advice regarding ongoing healthcare needs. Fanny graduated with honors from California State University, Los Angeles, with a Bachelor's of Science in Business Administration. She currently resides in Orange County, California with her husband. We asked Fanny to join us here today because we know Medicare can be a somewhat confusing and complex topic. Fanny does a great job explaining the basics of Medicare and can be a great resource as one transitions their healthcare coverage to include Medicare. We should have some time at the end left to address any questions, so please feel free to type those questions into the chat and I'll make sure to share those with Fanny at the end of our presentation. If we don't get to your questions today, we will make sure to follow up with you directly. With that being said, I'd like to welcome Fanny and let her take it from here. Thank you, Fanny.
Thank you for the introduction. I will share my screen and you know, again, I have over 15 years of experience in this field. Our agency, PBI Insurance, all we do is we specialize in Medicare senior products. I always try to make a joke of it. Sometimes it's funny, sometimes it isn't, but you know, we do in this field meet a lot of brokers that specialize in very many different lines of coverage. And so I just want everyone to know that here at PBI, Medicare is the only line that we do, and it's enough to keep us busy all the time. So I will now get started with the presentation and I will share my screen. So we'll get started with what is Medicare. Medicare is federal health insurance for people who are 65 years of age or older and certain younger people with disabilities. We did used to have the list of the disabilities that can have someone be eligible and qualify for Medicare, but those have actually changed. And so we've decided to just remove that from our presentation because it's different and it has evolved over the years. So again, this program is for people who are over the age of 65 and certain younger people with certain disabilities. Now, to be eligible for Medicare, you do have to be a U.S. citizen or a legal resident and have resided in the United States for 5 continuous years. Here we have the Medicare components and costs. There are 4 parts to Medicare, and this is what everyone sees and everyone's very familiar with. And so we'll start with the first part, which is Medicare Part A hospital coverage. Part A is just like it sounds, it's hospital coverage. This is the portion of Medicare that will cover and will pay your bills when you are hospitalized. So you're admitted and you're in the hospital. Medicare Part A has a premium of $0 per month if you worked at least 40 quarters or 10 years and paid and contributed towards Medicare taxes. Medicare has a deductible of $1,484. And this is a per episode deductible. And so this is different than most of the deductibles that you may be familiar with because most deductibles are annuals. Again, this is a per episode deductible. And the way I like to explain it is in the Medicare world, if you are admitted to the hospital, you would pay that $1,484. If you are there for a week, a month, then you are released. If you're out of the hospital for 60 days and then back into the hospital, it doesn't matter if it's the same condition or something new, you would pay that deductible again. So in Medicare, a new episode begins whenever you have been out of the hospital for 60 days. And so then on day 61, that would be the start of a new episode. There are other costs associated with Medicare Part A, but usually this deductible is one of the biggest ones. Then we have Medicare Part B. And so Medicare Part B, it's outpatient services. Part B is a portion of Medicare that will pay for your doctor's visits, labs, x-rays, chemotherapy is covered under Medicare Part B. There are certain medications like injectables that are covered under Medicare Part B. And Medicare Part B does have a monthly premium. The monthly premium for Part B, it starts at $148.50, but can go all the way to $504.90. So this is a range. And so Social Security, Medicare, it's based on your adjusted gross income from 2 years back. Now, every year it had been 2 years back. In 2021, Medicare, Social Security, we're looking at incomes for 2020. So this was the 1 year when there was that exception. Instead of going 2 years back, they were doing 1 year back. So again, the base amount is $148.50, but it can go up all the way to $504, and there are different ranges, and I'm happy to share those with you. Now, Medicare Part B has an annual deductible of $203. And Medicare Part B, even though it's not premium free, it only covers 80% of all the services. So if you have Medicare Part B, and you would be responsible for 20% out of pocket. And this can be 20% of 100,000, or it can be 20% of $100, or 20% of nothing if you haven't gone to the doctor and don't use the benefits. And so this is one of the what is known as gaps in Medicare. So that 20%, and also that 20% is limitless. In most insurance plans through your employer, there's usually a maximum out of pocket. So if you do happen to have a bad year, you know that there's a max that you would be responsible for, or you'd be liable for if you needed a lot of services. With Medicare Part B, that 20% is limitless. So Medicare Part A and B is what is known as original Medicare. So if you ever hear commercials that reference original Medicare, they are referring to Medicare Part A and Part B. Now we also have Medicare Part C, which are Medicare Advantage plans. And so Medicare Advantage plans have varying coinsurance and copays. And I will touch on Medicare Advantage plans further in the presentation. Then we also have Part D, which is prescription drug coverage. And Part D, I also will touch later in the presentation. But just quickly here, Part D are drug plans. And these are plans that are administered and are heavily regulated by Medicare, but these are offered through private insurance carriers. And so for prescription drug plans, there are plans that have premiums that range between $8 and $160. And so that is clearly a huge range. And I will cover that in more detail once I get further into the presentation. So these are the 4 parts of Medicare. And this is what you will hear a lot. And this is what people usually sometimes get confused. But we will learn on how they combine and how individuals get to use these different parts. So how and when to apply for Medicare? If you are receiving Social Security benefits when you turn 65, Medicare Part A and Part B enrollment will be automatic. So for example, if you are still working and you are covered by your employer plan and you love that plan and you have no intentions of retiring or canceling that plan, if you are someone who is receiving maybe survivor benefits, if you are receiving any type of Social Security benefit, you will be automatically enrolled in Medicare Part A and Part B. And so we always emphasize this because if you're someone who gets automatically enrolled in Medicare Part A and B, and maybe you don't want to have Medicare Part B because you want to keep your employer coverage, you're just not ready to go on Medicare, you do have to actually decline the enrollment. And so as of 2021, Medicare, for these individuals who are collecting Social Security, Medicare mails you your Medicare ID card. And now on the back of it, there's a little portion that you can complete where you can maybe just decide that you don't want it and you can decline the Part B portion and then mail it back to Medicare. This is new for 2021. Now, if you do decide to sign up for Medicare, or if you want to keep the Part A and Part B, the coverage begins on the 1st of the month of your birthday month. So if your birthday is May 15th, your coverage will start May 1st. Now, Part C and Part D are not automatic, so nothing will happen. You don't have to disenroll if you're collecting Social Security benefits. Now, if you are not receiving Social Security benefits when you turn 65, then nothing happens. Medicare will not sign you up. If you want to sign up for Medicare, you have to initiate this process. And there are 3 different enrollment periods when you can actually sign up for Medicare. The first one is the initial enrollment period. And so this is consists of a 7-month window. So the initial enrollment period begins 3 months before your birthday month and ends 3 months after your birthday month. Again, it's a 7-month window, and this is a time where you can begin signing up for your coverage. Now, yes, you can begin signing up for the coverage 3 months before your birthday month. However, your coverage will not begin until the first day of the month of your birthday month, unless your birthday is on the first. So if my birthday is May 1st, then my coverage can actually begin April 1st because you get that extra month. If my birthday is May 29th, then my coverage begins May 1st. Now, if you are someone who, when you turn 65, you are just not interested in signing up for Medicare because you have coverage either through your employer or through your spouse's employer, then if you do nothing, if you don't sign up during the initial enrollment period, then you have what it's called or known as a special enrollment period. And so sometimes there's confusion with this special enrollment period because there are no dates tied to the special enrollment period. If you are over 65 and covered by an employer plan and didn't sign up for Medicare, you have an ongoing special enrollment period. And so at any time during that coverage, you can actually sign up for Medicare. And there are more details and there are certain limitations when it comes to the enrollment. And then I will touch on those also. Now, if you are someone who missed the initial enrollment period and you don't have a special enrollment period, then there is always the general enrollment period. And this one runs between January 1st and March 31st. And so anyone who signs up during the general enrollment period, you sign up between January 1st through March 31st, but your coverage actually begins on July 1st, which coincides with the federal fiscal year. Now, the rule of thumb is that anyone who is using the general enrollment period to enroll in Medicare usually has some late enrollment penalties. So again, every situation is different. Medicare, there's a very small portion of it that it's the same for everyone, but a lot of the rules apply just different to different individuals. And so again, anyone signing up during the general enrollment period, usually you're late. You've missed the initial, you've missed the special, and then there's going to be some sort of late enrollment penalty. Now, to enroll in Medicare, if you are just turning 65 and you are in that initial enrollment period, you can apply directly through socialsecurity.gov. So yes, enrollment in Medicare is through the Social Security office. And this also sometimes causes a little bit of confusion. And it's as easy as you can apply online. Or if you are someone who just for some reason there's issues with your name and identity verification, then you can always call the 1-800 number and sign up over the phone. Now, if you are someone you're over 65, which means you waived Medicare when you first turned 65, and you are now signing up later on, it can be because you're retiring or you just simply decided you now want to join Medicare. Your enrollment process will be slightly different. You do have to sign up via paper form. And usually, you can mail these forms to Social Security. People used to be able to walk the forms into Social Security. Now we can fax them to the Social Security office. And I'm finding that fax works great. I haven't had a single fax gone missing. And I'll knock on wood because I don't want one to go missing tomorrow. So again, the enrollment process is different depending on whether you're just new to Medicare or you waive Medicare and you're signing up later on. And we have here, I am 65 and covered by an employer group plan. So what do you do? If you are turning 65 or you're already age 65, and there's different rules. And so this is why I mentioned that Medicare certain rules apply different to different people. So if your employer has more than 20 employees, then Medicare is considered secondary coverage. So if you do sign up for Medicare Part A and B and you keep that employer coverage, it doesn't matter. Medicare will be secondary. All the claims will go to your employer's plan first. Now, our recommendation is, if you are working and your employer has over 20 employees, upon turning 65 or as you near your 65th birthday, it's okay if you do nothing about Medicare. You should be okay. But we always recommend that you speak with a broker agent like myself, or if you have another one in mind, and then just look at the different options. Just compare what Medicare plans offer versus what your employer is offering. We often recommend that you sign up for Medicare Part A only if you're not doing the full Medicare, even if you have that employer coverage, because it's extra hospital coverage and it's premium free. Now, there is some limitations when someone's enrolled in a group fund HSA, a health savings account. So if you are enrolled in an HSA, then you do not sign up for Medicare Part A. You just don't sign up for any part of Medicare because there are some tax penalties that can come into play. Now, if you work for an employer that has less than 20 employees, then Medicare is considered primary payer. And so this often comes into play. And so we've, unfortunately this year, we've had a handful of clients that we've met and had claim situations. And so what happens here is that if an individual is turning 65 and he works for a small company of maybe 10 employees, he thinks that he doesn't have to sign up for Medicare because, well, he thinks he falls under the employer more than 20 category here. And so what happens is individuals just do nothing about signing up for Medicare because they have a group plan that maybe is covered at 100% by their employer. But again, if your employer has less than 20 employees, the rule is that Medicare is primary. So what we are seeing is that people are, getting sick, having claims, and that's when they find out that, oh, I should have signed up for Medicare Part A and B because Medicare is primary because my employer has less than 20 employees. And so this is some of the nuances with Medicare that can get complicated, and most people just don't know this. This is something that most people wouldn't know. And so again, there's always a huge difference. If your employer has over 20 employees, and if your employer has less than 20, just the rules are different. Either way, if you are turning 65, we recommend that you always compare what is offered to you by the employer against what you can find with Medicare, because sometimes we can find that coverage can be better or just more affordable and so forth. Just always have that evaluated. And there's no cost to have this evaluated, by the way. If you ever meet someone who wants to charge you anything for this service, that's wrong. Medicare has strict rules on charging for such services, so they're not supposed to do that. Now we have here Medicare and HSAs, and I recently added this slide to the presentation because I am finding that HSAs are becoming a lot more popular again. So if you have an HSA, you can contribute to your HSA, so that health savings account, once you have coverage through Medicare or once your Medicare coverage begins. And so this is why if you work for an employer that has more than 20 employees and you are covered by an HSA, you don't want to do anything about Medicare, because then you can no longer contribute and take that tax advantage that you would have with just putting those funds into the HSA. We always have to confirm that if you are enrolled in an HSA, not all HSA plans meet Medicare's Part D creditable coverage criteria. So yes, Medicare is okay with individuals waiving the coverage, but you have to have coverage that is as good or better than what Medicare would offer. And so, HSAs are sometimes complicated because, again, if you want to take advantage of the tax and the money savings, then you do not have to sign up for any part of Medicare, neither Part A nor B. But oftentimes, HSA plans don't meet Part D's creditable coverage criteria. And if you don't have Part D, then you're going to pay a penalty later on. So we sometimes go in circles when it comes to HSA. So I'm happy to connect with you individually if you have one, and then work through your situation. But if you do have an HSA, something that happens here is that HSAs, when you have an HSA and you did nothing about signing up for Medicare Part A, because that's the right thing to do, Part A enrollment down the line is always retroactive 6 months. So if if it's June, assuming it's June now, and you want to retire January 1st, or you need to stop contributing to the HSA 6 months before you want your Part B to be effective. Because even if you didn't sign up for any part of Medicare, A or B, when you do go to enroll, your Part A will be effective retroactive 6 months. And if you're someone who was contributing to an HSA, now you have found yourself in violation of some tax laws because you were enrolled in HSA, even if it was retroactive, and you were making contributions to your health savings account. So again, If you have an HSA, I'm happy to connect with you and we can work through those rules. So your Medicare choices, if you are someone who you're going to retire, whether you are 65 or you are over the age of 65, you're going on Medicare, you have two options on the type of coverage and how you will take your Medicare benefits. And this is where we see also a lot of confusion. So one of the options is original Medicare. And original Medicare, it's a lot like PPO. So you sign up for Medicare Part A, you sign up for Medicare Part B, you'll pay the Part B premiums. And then you sign up for Medicare Part D, you have to sign up for a prescription drug program. And then you would buy a supplement plan. And so these four parts will give you full coverage in terms of medical, hospital, prescriptions. Now, Medicare, the federal government does not offer coverage for dental and vision. Those are extras, and you can always buy those extra policies. But you do have another option. So another option is to sign up for Medicare Part C, which are known as Medicare Advantage plans. And in Southern California, most of these plans are HMOs. And so what happens here is you sign up for Medicare Part A, you sign up for Medicare Part B, you always pay your Medicare Part B premium. And so most Part C Medicare Advantage plans already include a Part D prescription benefit. And so, it's what is known as an all-in-one bundle. And so these plans also tend to have extra benefits such as dental cleanings and vision coverage and so forth. And I'll cover these in more detail. But I like to show this slide because anyone who goes on Medicare, these are your two types of coverage options. You will have original Medicare or you will have a Medicare Advantage Part C plan. Now, if you are someone who decided you are going to sign up for Medicare Part C, an HMO plan, these plans are very attractive because in LA County, and now in Orange and some parts of the Inland Empire, these plans have a 0 monthly premium. And so you sign up for Part A, Part B, you pay the Part B premium, and then there is no other monthly premium that you have to worry about because the Part C HMO plan that you selected doesn't have a monthly premium. Now, these plans have varying coinsurance. So these plans work a lot like your HMO. If any of you are enrolled in an HMO, you know that you have a copay to see your primary care doctor, a copay for the specialist. So that's exactly how these plans also look. There'll be, some of them have zero copay for PCP, zero copay for specialists, and some of them have zero copay if you're admitted to the hospital. So they are very competitive. And again, these are known as all-in-one bundle plans. These HMOs will give you a low medical out-of-pocket cost. And so the reason why individuals sign up for a Part C, so you don't want to just keep Medicare Part A and B, and because you would be responsible for that 20% out-of-pocket that is limitless under Part B, right? So once you sign up and you choose a Part C program, that plan will have a maximum out-of-pocket limit, just like your plan does now. So if you do have a bad year, you know that there's a cap on what you would potentially spend. And a lot of the plans in LA and Orange County now have maximum out-of-pocket limits as low as $1,000, $700. And for 2022, there's some plans that are going to have plans with maximum out-of-pockets even lower than that. Now they're getting into max out-of-pockets of $500. And this is an annual max out-of-pocket, so it's very, very competitive. These HMO plans do include some vision benefits, so vision optometry. They do include some dental cleanings. They have hearing benefits. They include acupuncture and chiropractic services. Again, most of them are HMOs. And so what you do give up is that when you select a Part C Medicare Advantage plan, now you are part of that HMO network of providers. So when you want to go see a cardiologist, you have to get a referral from your doctor, and you will be referred to a cardiologist that is part of the medical group that you have selected. And so these medical groups, these HMOs are regional, and they are contained to smaller counties, so they're not large HMOs. Again, these also have fitness memberships, which are very competitive and people like a lot. And these plans cover your Part D prescriptions. And so when it comes to Part D prescription copays, the maximum out of pocket is $6,550. And this is a scary number. And realistically, most people never spend that much in their prescriptions. But these plans, I always find the need to bring up the point that your prescription copays, if you take very expensive medications, could be up to $6,550. And I always like to bring that up because when you see those commercials on TV, those plans that say, if you're Medicare eligible, you qualify for a plan that is free, and then they tell you free dental, free vision, free medicines. Well, what they're not telling you is that your copays, if you take expensive medications, could be up to $6,550. And so I just want you to be aware of that. Now, these Part C Medicare Advantage plans renew on October 15th to December 7th. So we're about to enter what is known as the annual election period. So annual election period runs from October 15th till December 7th. And this is where anyone who is enrolled in a Part C Medicare Advantage plan, this is where they can evaluate their plan options and maybe switch the plan. And then those changes take effect January 1st of 2022. Then we have prescription drug programs. So if you're someone who you've maybe never been on an HMO, you don't know how to work an HMO system, and you are not interested in learning, so then you would be someone who signs up for Medicare Part A, Part B, you pay those Part B premiums, and then you have to sign up and shop for a standalone prescription drug coverage. And so this is where Part D comes into play. And Part D premiums range from $8 to $160. And the reason why there's this huge range is because in the world of Medicare, prescriptions are broken into 5 different tiers. So we have tiers 1 through 5. And in tier 1, usually prescriptions have copays of $0 to $3. Then in tier 2, the copays go up from $5 to $10 and so forth. So there's about 80 different plans in every county. And so the way we select or we help you choose a prescription drug program is specifically based on the type of medications that you are taking. So we go to Medicare.gov, we enter your list of medications, and we find the program that covers your specific combination. Now, these prescription drug programs have a deductible of $445. I do know there's a typo here on the slide. It says $425, but it's actually $445 for 2021. And so this deductible is not set by the insurance company. Again, Part D programs are regulated by Medicare, but you sign up through private insurance carriers. And it's Medicare, it's the centers at CMS who dictates what that deductible will be. And so for 2021, it's $445. Now, insurance companies can have prescription drug programs with deductibles lower than $445, even with 0 deductibles, but they cannot have a deductible higher than $445. Now, when I was covering the different parts and components of Medicare, and I was talking about the Part B premium that has a range of $148.50 to $504, I didn't mention that if you are someone who lands in a bracket higher than the $148.50, then you pay more for your Part B premium, right? You can pay up to $504. If you are someone who's in, again, one of those higher brackets, then when you buy a prescription drug program, you also pay an additional fee for the prescription drug plan. And that is what's known as the IRMA fee. And that's the income related monthly adjustment amount. So if you're a higher income earner, you will pay this IRMA fee. And so this IRMA fee doesn't buy you anything. It's just a fee because you're a high income earner. Now, these prescription plans have copays. And so the copay varies. So tier 1 medication copays, like I mentioned, there could be $0 to $3. Tier 2 medication copays could be $5 to $10. We have some plans that have copays up in the 100s, depending on the prescriptions that they're taking. So this is very important because oftentimes, we meet clients and they say, well, my neighbor pays nothing for her medications. Well, that's probably because your neighbor is taking 1 or 2 or 10 medications, but they are all tier 1. And so the copays may be 0. I may be taking 1 medication, but if this is a tier 4, my copay may be $140. And so I don't mean to scare you with the $140 copay, but the ranges are just that crazy sometimes when it comes to Medicare. The prescriptions, as everyone knows, it's the one part of Medicare, what I call the variable in Medicare, because it can go up depending on what you're taking. Now, the potential maximum out of pocket for prescription drug plans is also 6,550. And if you notice, this number looks a lot like the maximum out of pocket for the prescription component in Part C. And that is because this maximum is also set and dictated by CMS. CMS decided that the most that someone would spend in prescriptions is 6,550. And sometimes people do spend even a little bit more, but it's very rarely that happens. Now, these prescription drug programs also renew on October 15th to December 7th. So again, we're about to enter the annual election. October 15th is when the whole thing will kickstart. And so during this period, what the plans that are renewing are the prescription programs and the Part C HMO programs. Again, if you're that person that you're not going to go with an HMO Part C plan, you want to keep that PPO type coverage and the freedom to go to any doctor that you want to, then you sign up for Part A, Part B, pay those Part B premiums. You sign up for Part D, you have to pay that Part D premium, and then you buy a Medigap supplement policy. And so when you're choosing a Medigap supplement policy, these policies have premiums that range from $70 to $185. Now, these premiums do increase with age. And so, one of the richest supplement plans available at the moment is Plan G. And so Plan G has a monthly premium of $138 for someone who's age 65, but it does go up. And so once you're up in age 80, that premium can go all the way up to $380. So it gets more expensive as you get older. That's one of the cons of just having a supplement plan. But again, when you have Medicare Part A, Part B, and your Medigap supplement policy, you can go to any doctor in the US that accepts Medicare assignment. So if you want to go to the Mayo Clinic, you can. If you live in California but want to go see an orthopedic surgeon in Utah, you can do that. As long as that doctor accepts Medicare assignment, you can go anywhere in the US. Now, supplement plans vary. We have plan letters A through N. So you notice how they reuse A, and I don't know why. And so sometimes I find myself correcting my clients because they refer to Part A as Plan A, and I keep saying, no, it's Part A. And then sometimes I find that I don't want to be rude, but there is a supplement Plan A. And so I don't want you to be, later on maybe confuse it with Part A. So again, there's just different supplements, the premiums range. And so they're just tailored to each individual. What works for you may not work for your spouse. And so that's something that we can help you narrow down. Now, these supplement plans, some of them also include vision, they include hearing, they include travel insurance. And so they include fitness memberships, and supplement plans renew on your birthday month. So remember that day, October 15th, that's when open enrollment annual election begins for prescription drug programs and Part C programs. So anyone who's on a Medigap plan usually will also have a Part D plan. And during annual election, the only piece of your coverage that is renewing is your prescription program, not your supplement plan. But there's always a lot of confusion because people think that their supplement plan is also renewing. So your Medigap supplement plan renews on your birthday month. And unfortunately, you get a happy birthday card and then you get a rate increase. That's also when the rate goes up. It's on your birthday. I do want to touch on travel insurance, because I always meet people who, they're super excited about the supplement plan because they think that now they can travel and they're going to be covered worldwide. Well, travel insurance is limited to $50,000 for the life of the policy with a $250 deductible. So, I always like to bring that up because I want you to think about that. If you're going to, Canada for a couple days, maybe that's good enough. But if you're going to Europe for a month, you may want to still consider buying travel insurance. So again, travel insurance is there, but it's not as rich as sometimes people make it seem to be. And now I have my other Medicare coverage options puzzle pieces. I like this slide because Medicare and the parts, they just work differently. And so I like this because it just shows you the different parts and the coverage that you can sign up for. So again, we have that very top, we have Part A, Part B, and then a Part D plan, and then a Medigap supplement plan. So if you have that type of coverage, you have something like a PPO, except it's actually better than a PPO, because if you have a PPO now, you still have to go to doctors that are contracted and are part of your PPO network. When you have this top Part A, B, D, and Medigap, you can go to any doctor that accepts Medicare assignment anywhere in the US. Then you also have the option of Part C, Medicare Advantage. And again, this is the all-in-one plan that includes your Part A and B benefits. So what happens here is you pretty much give up, or you give, yes, you give up your Part A and B benefits to that company, that private insurance HMO, or even some of the Medicare Advantage plans are PPOs, but they're still Medicare Advantage plans. So you give them your A and B benefits, they administer those benefits for you. And so these plans usually include prescription drug coverage. And again, the big thing here is that it has a maximum out of pocket annual limit, so that now you're no longer responsible for 20% of limitless coinsurance. And then you also have the option actually of signing up for Part A, Part B, and Part D. You don't have to buy a supplement plan. If you feel that you are healthy and you're going to just self-insure that 20%, you can do that. But there is a catch, and this is something that it's not even spelled out in the Medicare and You booklet. Doctors are allowed to bill an excess amount of 15%. So Part B, you are responsible for 20%, but then you're also responsible for that excess amount of 15% that doctors are allowed to bill. And trust me, most of them do bill them. So you're really out of pocket 35%. So this is why most people don't do, the last third option, Part A, B, and D. They always, when they want to keep that type of coverage, they always add the Medigap policy, because the Medigap policy is that plan is a policy that will cover the Part A deductible, that $1,484, and will cover the 20% coinsurance from Part B, and will also cover that 15% excess that your doctors may or may not bill. And then they include a lot of other benefits like hearing, vision, optometry, and so forth. You notice how I never really mentioned dental? That's because dental is not part of any supplement. Again, it is included in some Part C Medicare Advantage plans, but only cleanings. And so I'm very passionate about this. And so when I see these commercials that say that you're going to have free dental and free vision, they mean 2 cleanings a year. And I hardly consider 2 cleanings a year to constitute dental coverage. So again, that's something that you would have to research, and we can help you do that, and you can add to your coverage. So this is my last slide in the presentation. Next, we have here my contact and my business partner, Kim Caldwell. And what can we do for you? We offer personalized service. We help you compare your current coverage through your employer, whatever plan you have now, against what Medicare has to offer. And we have been doing this for over 15 years. So we are not, we are not sleazy. We're not just anxious to make a sale and get you off of your great plan and go on Medicare. When we find that your current plan is best, we recommend that you keep that and you don't go on Medicare. We're happy with doing that. It doesn't cost you anything to speak to us. And again, if you are someone who have met a broker or someone who was charging you for a Medicare consult, that's actually illegal. So don't pay for those. But we are a brokerage firm. We certify and we are licensed to represent Humana, Blue Shield, Anthem, HealthNet, ARP, UHC, and many others. And I like to mention this because when I meet someone, when I meet with a new prospective client, I don't care if you go to Anthem. I don't care if you go to HealthNet. I will talk to you and I will recommend the plan that best fits your budget and your needs. We owe no loyalty to Anthem or Humana or Blue Shield. If you call them directly, you'll never know what the other carrier had to offer. And costs associated with these plans are the same whether you come through a broker or you go through them directly. I know that's a lot to take in. And so, my goal with this presentation is that if you were completely lost, at least you now have a perspective, you know what the 4 parts are, you know that you have to choose, and again, you'll get to listen to the recording. And I find that every time, the more you listen to it, the more you catch on.
Definitely. Thank you so much, Fanny. I know we didn't have very many questions come through, but we did have one about access to the presentation. We will be sharing the slides in a follow-up email, along with having a recording available to individuals to watch back, or if you weren't able to be present for the whole meeting, to be able to watch back this information about Medicare. So I want to start off by just saying thank you to Fanny for being with us today, for providing just great information and education about Medicare. Again, we will follow up with an email that'll include this contact information that Fanny has posted here, so that anyone who does have specific questions about their own plan can reach out to Fanny. And if you have any feedback for us, share with us on any topics that you'd be interested in us covering in the future, and send us an email. Keep an eye out. We will be sending out another invitation for a webinar closer to the end of this year. And I want to thank everyone for taking time out of their schedule. And we look forward to seeing all of you at our next webinar as well. Thank you so much, everyone.